They're first on the scene and the first to walk into danger.
We're training for the real deal. God forbid if it ever comes this way. Hopefully it won't, but we're preparing ourselves, you know. We have families we have to go back home to. We want to make sure that we protect our families, we protect the public.
The threat to firefighters became apparent end of February in Washington state, where more than a dozen firefighters from the town of Kirkland responding to this assisted living facility were exposed to the coronavirus.
They were not aware or told that these patients had the coronavirus, so they used the standard protocol that you would use on a call to this facility.
The first responders who may have been exposed were quarantined. City officials report 12 of the 32 who were quarantined are now showing flu-like symptoms, and 19 have confirmed direct exposure. Even though there are fewer cases of coronavirus here than in Washington state, Chicago firefighters are prepping for a possible outbreak.
So anyway, this is what you're going to see them put on. This is the PPE kit, and this is all the emergency products that they're going to be using.
PPE stands for Personal Protective Equipment. Lieutenant Q says it's only used when there's a suspected coronavirus case.
If you notice, when they first started, they put a pair of gloves on. They start with a pair of gloves that way that their hands is covered at all times. Then they take it, they'll put their gown on. They'll assist each other in tying it up. After that, they'll glove up again, and then they'll put their shields on.
The gown, the mask that they're using, that gets disposed of every single incident?
Everything, if you wear this, we dispose of it. It goes into a bio bag, and from the bio bag to the hospital, and the hospital disposes of it.
Patrick Morrison is the assistant to the general president for health and safety for the International Association of Firefighters. The organization represents more than 300,000 firefighters and paramedics in the U.S. and Canada. Morrison says for serious outbreaks, emergency responders may have to consider rationing masks and using them more than once. And there's another problem. Morrison says dispatchers who send firefighters out to respond to emergencies may not be trained to ask specific questions to identify coronavirus patients.
The problem with dispatch is that the proper protocols have not been written in to responding to this infectious disease, to this coronavirus.
Neither Chicago nor Kirkland has a specific coronavirus prompt for their dispatchers. Instead, dispatchers rely on an infectious disease questionnaire that's been in place for years. It can help determine coronavirus symptoms, but some cases could still fall through the cracks. So far, Chicago's fire department has received 9 coronavirus-related calls since December. Fire Department EMS Chief Juan Hernandez says communication is key.
If they have to call 911, to please inform our call takers at the Office of Emergency Management to give them information of what their symptoms are. That way, when our firefighters and paramedics respond, they can be appropriately dressed in their personal protection equipment. That information will then be relayed over to our receiving hospitals.
The motto of the Chicago Fire Department is, "We're there when you need us." Now they want the rest of the community to be there for them.